Monday afternoon. Thank you so much for joining us on your MTN Statewide News. On Victoria Hill, Andrea has the day off. This week marks 1 year since the World Health Organization declared the coronavirus pandemic. It's been a year for health officials and healthcare workers of learning as we go. CBS News Chief Medical Correspondent Dr. John LaPook sat down with Dr. Anthony Fauci to discuss where we've been and where we're headed.
In 2016, when I interviewed you for 60 Minutes, I said, what keeps you up at night? And you described this year.
My worst case scenario is to have a combination of factors that would lead to a historic pandemic. And unfortunately for us and the world, that's exactly what happened.
Dr. Anthony Fauci says 1 year ago, he wishes we had known just how capable the novel coronavirus was of spreading so easily.
That is really a game changer for an outbreak. It would be so unusual to have a respiratory disease of this magnitude in which such a large percentage is driven by people who have no symptoms.
Nearly 30 million have been infected in the U.S. More than 500,000 have died. And while we now have several vaccines that are extremely effective, the virus is changing, with the variant that originated in the UK, 117, spreading rapidly. We have the appearance of all of these variants of concern.
It's kind of a bit of a race of getting as many people vaccinated as you possibly can with these variants which are assuming dominance. The news that's somewhat encouraging is that the vaccines that are being distributed currently in the United States, particularly the mRNA vaccines, do pretty well against that 117.
Dr. Fauci says the best way to stop variants from developing is to stop the virus from spreading, and he's worried about relaxing restrictions prematurely. You look at a state like Texas that has opened it up for all intents and purposes. When you see that, what's your reaction?
It's dismay. It's ill-advised. What you really want to do is get the baseline very far down and then gradually pull back on the public health measures. But to just turn it on like a light switch and turn it off like a light switch is very risky.
Looking ahead, what do you see the big challenges are?
You really want to get the overwhelming majority of people vaccinated, not only for their own health and their own safety, that of their families, but the fact that they will then be contributing to this overall effect of what we refer to as herd immunity.
Dr. Fauci says the public must avoid being lulled into a false sense of security.
We want to make sure we don't generate another surge, which is the reason why it's no time now to pull back on some of the public health measures.
Lessons learned this past year that will follow us into the future. There will be another pandemic, right?
There's no doubt about it. Can't say when or where or how, but if history tells us the truth, which it does all the time, this will happen again.
Dr. John LaPook, CBS News.
And Dr. Fauci also tells us the U.S. is stepping up to do more sequencing of the variants to better understand how and where the variants are occurring. And meanwhile, more local educators will be vaccinated against COVID-19 this week following the rapid rollout of shots specifically earmarked by the federal government to help those working in our schools. But what's really fueling the effort is the quick response of local schools and pharmacies.
And so it's been this roller coaster, I think, especially this week of emotions, because we've been talking about when's the vaccine coming out, when's it going to be here, when are we going to have a chance to do that. And we've had some great partners between Corvallis Drug and Bitterroot Drug that have really come forward and said, hey, let's get those educators with shots in arms.
Cronin, who you just heard from there, was among the teachers, administrators, and staff getting their shots in places like Corvallis and Hamilton last week. And since these are the new one-shot Johnson & Johnson vaccines, that means the educators will be able to get their effective protection much sooner. Cronin, who had the virus last fall, sees this as the responsible move by the schools, which play a key role in community protection.
District employee like myself, you have to think about kids and staff and people that come onto the campus, and so having that district-wide viewpoint. And so, our number one piece has always been safety, and it's going to continue to be safety.
Educators can visit vaccinefinder.org to find a local pharmacy scheduling vaccine appointments. Now, before we take a break, the country has been through a lot this year. We're looking at how we can all improve race relations. Reporter Chris Conti looks at something experts say we do in our minds, but might not realize.
If we don't get it, shut it down! What's that smell? Black Lives Matter!
For better or worse, there has been no shortage of difficult conversations these days. So much of it can seem so overwhelming.
You know, the division is stark right now. I think everyone can see and feel that.
Figuring out how we got here, though, requires a good, hard look at our communities and ourselves, and taking a deep dive into something you've likely not been familiar with, something called implicit bias. These four people all study implicit bias in one form or another.
We only see the world through a single lens, a single set of eyes, our own.
It really comes from our lack of understanding of people who are different than ourselves.
It basically means that you favor one thing over another.
Implicit bias means we do things without being aware of them, making decisions or taking actions based on preferences we might have toward a person or groups of people. Here's an example. A boy and his father are in a car accident. The boy is rushed to the hospital. At the hospital, the surgeon shouts, "That's my son." 40% of people come up with some elaborate reason for who the surgeon is, when in reality, the surgeon is the boy's mother. The implicit bias here is that surgeons are typically men.
It's natural to have bias around other people. We're born with it.
It really comes from our lack of understanding of people who are different than ourselves.
Raul Fernandez studies equity, diversity, and inclusion. He says being conscious of internal biases just makes us more aware of the struggles others are facing.
There's a certain point at which we do become responsible for our own understanding of the world.
Being aware of implicit bias might help us find more common ground.
I think if folks can start to sort of do the deeper work of getting to know who folks truly are, I think we wouldn't be so scared of each other.
Not an easy conversation to have, but an important one nonetheless.
That multiple perspectives, multiple ideas, everyone doing well, makes our communities better places to live.
I'm Chris Conti.
And many of these issues will be covered tonight at 6 o'clock on your local MTN station. We'll be airing a special presentation called Hidden Bias of Good People.